really excited to hear that you're talking this year about the social determinants of health. And here's why. We talk a lot about health disparities, and I'm sure many of you are going to be speaking about health disparities, but I do want to give you a distinction. When you think of disparities, what do you think of? What's a synonym for disparities? Inequalities is actually not a synonym, but it's in the ballpark. I would think differences. That's really what disparities are. They're the things that are different, right? The problem with the disparities model in and of itself, if that's the frame that we're looking at to try to understand health inequalities or health inequities, is it looks at the differences. And the differences typically happen downstream, right? I like to put it in a health inequality or health inequity frame because that's pulling the attention, not from the things that we see after the fact downstream. You know, men have more of this than women, or this group has more of this than that group. But I like to pull it upstream and look at what are the systematic and the structural factors that give rise to those differences. And the reason that I think it's important is because wherever we look at the problem, that typically tends to be the same place where we look for the solution, right? So if the problem is down there, they have more of this than they do, then what we do, we provide programs for this group to get them to have outcomes similar to this group. I take care of my stepdad. He's 76 years old. He actually outlived my mother, who was 17 years his junior. And being with him is really interesting. He has unmanaged hypertension. He has unmanaged diabetes, mostly because he won't give up orange soda or change what he eats. And he constantly has problems with swelling. And so I go down to his house and I hang out with him a little bit, and I notice that his hand is swollen. And he's got some big jar of salve sitting on the table. And he's just like every 5-10 minutes, because, you know, the hand's getting swollen, so the skin's kind of tight, and it smells like that, you know, kind of grandma salve, kind of mentholated. And I said, well, what's the problem? And he says, well, my hand is swollen. And I said, well, how long has it been swollen? Oh, a few days. And he just keeps rubbing more and more salve on it. And I take him to the hospital, and he's actually got a blockage in his neck and his shoulder, which is giving rise to the swollen hand. And I sort of think that's a good analogy for sometimes how we approach health at a population level. We want to put salve on the hand and not actually go to the root of the problem. And so I think it's important for us to just sort of understand and acknowledge that, because oftentimes if we look at the problem as down here and not up here, then our programs sort of are also operating at that level. So the thing that I think that we should do is take and program people, don't get mad at me. You promise not to get mad at me? We cannot program our way out of these problems. It doesn't underscore the importance and the need and the great work that we do with some of our programs. But again, if the problem were the people, then the solution would be the programs for the people. I worked with the organization at Hopkins called the Urban Health Institute, and I am so proud to have been affiliated with this organization, because when I came there, it was a group of well-meaning people. They were working in East Baltimore, and as an entity, they're charged with the health of East Baltimore residents. And they had 2 programs that they were running at the time. And the first program in East Baltimore, which has very high rates of obesity, lots of hypertension, and other kinds of chronic conditions that are both diet and stress-related. And so they rolled this program out and were giving free gym memberships to the people in the community, right? Because can you see if the problem is that those people don't eat well, those people don't exercise, those people don't have the money to afford access to, the kind of recreation that one would need to maintain health and fitness, the solution would be free gym memberships. And that's the program that they were running. And I came in and I was like, why don't we rebuild all the sidewalks so that the kids have a safe place to ride their bikes up and down the street? And why don't we rebuild the front porches of any neighbor who agrees to serve as a natural monitor for the community? Because if we could get people back out on their stoops, monitoring their neighborhoods, and if kids had a safe place to recreate outdoors, maybe we could move the needle, right? They had another program. The second program they were running is massive problems with arrests, many arrests of which are never actually prosecuted, but an arrest record, it can be just as debilitating as a conviction, and the impact of just being pulled out of the community for some period of time. So they identified as one of their key problems in the community, they had this very high need for legal services, and that was the problem they identified. Again, we're looking downstream, right? So if you're downstream, the problem looks like what we need are legal services for these poor, disenfranchised, people of East Baltimore. And I said, well, how about instead of spending all of that money that way, how about we create a citizens advisory board that works in concert with the police department? How about we work through the community policing division to identify why so many young African-American males in these communities are being arrested in the first place, and 70–80% of them are being arrested but never actually prosecuted? Why don't we invest that resource in if you feed people, they will come? I'd rather buy food for every community meeting to get the community empowered to deal with the fact that there's a grave injustice happening with the way policing is being rolled out in the community. And the problem isn't that these young men need legal representation, which they do. The problem is the system needs to change. The problem is we have racism in the enforcement strategy of our laws. If we can create programs, let's create programs to deal with those things. Let's change the upstream. So I want to give you kind of a lens through which to kind of view and hold each other to account for what's both being proposed and what's being said. Anybody in here a baker? Any bakers in the room? I'm a baker, and my daughter's a baker too. She's now 13. We started baking together when she was about 5, and she's really great. And if you've never baked with a little one, it's really fun. They get so excited about everything, right? And so we got the Betty Crocker cookbook, and it's this, red and white, kind of the classic Betty Crocker cookbook, and we just made a classic vanilla cake. And to be honest, I had never baked a cake from scratch myself. I was, kind of in college, we do the slice and bake cookies and things like that, but I had this beautiful daughter who loved to bake, so I got into baking. And so we went to the store, and we got all of our ingredients, and we laid everything out on the counter, and we baked this cake, and it's in the oven, and, she's standing at the oven with the light on, and she's kind of peering in, and there's flour and mess everywhere. So I said, okay, well, you stand over and you watch the cake, and I'm going to put all the ingredients away. And as I began to put things away, I noticed that the box of sugar that we had bought was unopened. And she looked over, what's wrong, Mommy? I said, baby, we messed up. She said, what'd we do? I said, we forgot to put sugar in the cake. She says, well, can't we just sprinkle some on top? And I looked at her and I said, we could, but unfortunately it doesn't work like that. But that's what we do in our world. We have fundamental things missing from the system. The structure is fundamentally flawed, and we want to sprinkle sugar on top. We want to sprinkle some programs on top. So I'm just encouraging you to really unpack for yourself what the social determinants of health really means, what structural factors really mean. We have baked a cake, and we forgot to put the sugar in. We can't just sprinkle it on top. All right? And you guys are awesome. Thank you for all of the work that you do. I'm so impressed by all the different sectors are here, and just thank you for including me.